Lung ultrasound is more sensitive, accurate, and reliable for diagnosing pneumothorax than chest X-ray. Ultrasound-guided thoracentesis is also safer and more convenient than traditional methods. Diagnosing neonatal pneumothorax by ultrasound is easy to learn, can be performed at bedside without radiation. It also can be used to precisely locate the puncture point for safer thoracentesis.
Before beginning the ultrasound, select a high-frequency linear probe and sterilize the transducer. Select the Lung Ultrasound preset. To optimize the imaging settings for an examination when no lung ultrasound preset is available, select one of the Small Parts presets and use the Depth button to adjust the depth to 4 to 5 centimeters. Use the Focus Zone button to select one or two focuses and adjust the focus close to the pleural line. Click the Speckle Reduction Imaging button and select a level of 2 to 3 to reduce the speckle noise. Turn on Cross-Beam Reduction Imaging and select a level of 2 to improve the contrast resolution. Then select Fundamental Imaging for sharper A or B lines. Next, apply an appropriate volume of warm gel to the transducer to keep it in good contact with the skin surface, and place the infant in a suitable position.